the manager of North York Harvest social enterprise, FoodReach. Since 2018, FoodReach has been the logistics partner to the Creating Health Plus program, purchasing and distributing weekly nutritionally dense food allocations to the 30-member drop-ins across the city. I'm here today to express my support for Creating Health Plus, a critical program that has provided healthy food to drop-in agencies since 2007. Historically, there has been designated funding for the program, but due to the departmental restructuring, this is no longer guaranteed beyond September 2022. Creating Health Plus is a localized effort in alleviating hunger and improving food insecurity among Toronto's most vulnerable populations, which aligns with the Poverty Reduction Strategy's food access recommendation to eliminate hunger and increase access to affordable, nutritious, and culturally appropriate food. Throughout the pandemic, drop-ins have been the frontline response to addressing significant increase in food insecurity and poverty through their meal programs, which are in alignment with the COVID-19 emergency response. In 2021, the number of meals these programs served increased by 23%, and as you heard in Mark's deputation, some agencies saw a 50% increase. Simultaneously, food prices grew by 4% and are projected to increase this year by 5 to 7. With little to no change in food purchasing budgets for these programs and a snowballing need for emergency food services as the pandemic persists, the removal of the Creating Health Plus funding only further strains services that are already suffering and overworked through this crisis and put our city's most vulnerable in more precarious and undignified conditions. The decision to cut a $333,000 program, an objectively small line item in the city's budget, coupled with the lack of support we've seen from our city's most vulnerable populations throughout the course of this pandemic, will send a clear and consistent message that the city's priorities are not with the citizens who need it most, but rather that the city is more interested in targeting these services and populations and fostering further scarcity, particularly when the Toronto Police Service received a unanimous approval of a $24.8 million budget increase. It's also worth noting that Creating Health Plus does not exist in a vacuum. Removing guaranteed funding from Creating Health Plus has a cascading impact on the entirety of the emergency food access sector. Beyond serving 30 drop-ins, nearly 300,000 pounds of nutritionally dense food in 2021, FoodReach North York Harvest Social Enterprise not only leverages the purchasing power of the program to reduce food costs and pass these cost savings on to the rest of the sector, but we also reinvest revenue back into the community. As food costs increased this year, our initiative reduced produce prices by 8% with the help of Creating Health Plus's purchasing volume. This means that each current and future emergency food access center purchasing through us will receive this cost savings, allowing food budgets to stretch further to serve the people of Toronto. So this small budget line behaves not only as a support for critical services, but as an investment in something much larger, a nonprofit full-service food supplier developed exclusively for our sector and run by Ontario's second largest food bank network. This year, our project retained $470,000 within the sector, a 15% increase from 2020. This signifies a demand and need for FoodReach's services and proves that when we have the city's support behind us, we can not only generate impact, but foster meaningful long-term innovation. By cutting this designated funding and requesting drop-ins apply for a general funding pool, you are collectively encouraging inefficient use of city dollars. Individual drop-ins do not have sufficient purchasing volumes and the luxury of time to acquire the food pricing that we have negotiated for them, meaning drop-ins will be overspending on food, and the city is effectively spending more money to feed less people. With the city dealing with the pandemic response and high levels of food insecurity, now is the time to act and ensure programs like Creating Health Plus are adequately supported. I ask this committee to put forward and support a motion to extend the program's funding by 6 months this year to ensure the program's survival and capacity to provide provisions to agencies who need access to these foods in a consistent and reliable manner. This would bring the motion total to $182,650. The City of Toronto has an obligation to ensure those most vulnerable, especially during the pandemic, receive the most basic nutrition that will give them a fighting chance to survive and improve their lives. Creating Health Plus is a program that meets that obligation, and we need to ensure it is adequately funded. Thank you for your time.